Hi, good afternoon, Franz.
Hi, Christine.
Yeah, and this is Professor Dr Franz Ruppert from Germany, and I'm interviewing him because this weekend we are having a workshop here in London, and I'm back again. Yeah, the last time in Poland and now in London.
London.
Seem to be following you around Europe. Okay, Franz, I would like to bring some focus to parenting and like to hear from you through your academic and professional experience. Can you share with us and the people back in Asia how one's childhood relational trauma can create inner conflicts in adults, for a start?
Yeah, it's mostly the basis for most of the conflicts that we experience in our adulthood. They can be traced back to very early stages of our life, even before we are born. We have seen it. So, of course, our childhood is the basis for being an adult. And if our childhood was awful, was full of experiences we could not tolerate, then we still have them within us, and we act them out as an adult.
Okay, all right. So, can you also share with us how does a conflictual parents, between father and mother, relationship affect their children? For example, maybe frequent quarrels and fights between parents, the father and mother.
It's a very, very awful situation for a child, because the child needs to have a safe place and to develop and to be confident in their own abilities. And then if you see all the time your parents are struggling, they're fighting, then you firsthand you feel yourself unsafe and insecure. On the other hand, you want to support the parents. And mostly when the father is violent and the child observes that the mother is beaten, then of course the child wants to support the mother and do something to help the mother.
Or vice versa.
Yeah, mostly the violence is coming from. But same, if there is a mother that's always pushing pressure on her husband, then the children maybe feel compassion with the father and try to support him.
So you know, how does it affect the child when they grow up? I mean, in this sense.
Yeah, that is for them. They are distracted from their own development. They always have to focus on the parents. They have what they are doing. What do I have to expect from them? How can I do something to make more harmony?
Okay.
And so the child is not able to grow up on his own way.
Okay.
But it's always the parents are dominating.
So simply kind of forgot about themselves as a person.
In the end, maybe you no longer look with your own eyes in the world, but you look in the world with the eyes of the parents, the mother or the father.
And you know, from a scientific viewpoint, how do you explain that an unseen parental conflict will still affect children? Because, like, for example, some parents that I talk to, they feel that, because they don't quarrel in front of their children, you know, they quarrel behind closed doors, and they, you know, they don't show conflicts in front of their children. So from the scientific, you know, reasoning, how do you explain that it still affects the children?
Because children are so sensitive. They feel the atmosphere.
Okay.
They do not listen too much to the words that are spoken out, but more to the emotional background of that. And they feel if there's a cold atmosphere, if there's this hostile atmosphere, they feel it. They feel frightened and they feel threatened by that. And even it's not shown or openly shown.
It still affects the children.
Yeah, they still sense it.
Yeah. So what's going to happen if parents do not look into their own childhood traumas? What will happen to both parents and to the children? Yeah,
the normal way is that this trauma is still there, and it will be acted out in the relationships. For example, if you are very anxious because of what happened to you in your childhood, you have had some threats, then you see it whenever the child does something. Don't do that, don't do that, it's dangerous.
Being protective.
Being overprotective. So it's whatever you do not inside yourself, see it inside yourself, you see it in the outside, and then you project it, for example, to your children.
So are you saying that based on this, most children who are having behavioral or mental or maybe even physical symptoms, it has got something to do with the parents?
It's always the best way if you see such behaviors or the symptoms in the children. First of all, look at the biography of the child. How was the pregnancy, how was the birth process, and so on. And then put the question, what can I do as a father, as a mother, what can I do for myself in order to take out the stress in the relationship with the children?
Okay, that sounds good. So, lastly, do you have any words of wisdom for parents in Asia? Back in Singapore and Asia, yes, any words of wisdom for them after your 20 over years of experience?
The more you take care for yourself, the more you are in contact with yourself, the more you are really focused on yourself and healthy eye, the better it is for the relationship with the partner and the same relationship with the children.
Okay, and how do you do that? How do you...
Look at yourself. Look at your own, look at your own issues. Don't distract yourself by looking at your partner. Don't distract yourself by looking at the children. It's most of the time it's a distraction. We do distract us from our problems by looking at others.
Okay. Thank you, Franz.
You're welcome.
Thank you.